I'll go stand.
Okay. Good to go?
Get an audio check with your name.
Yep, sure. Emma Field, COVID-19 Coordinator at the Murrumbidgee Local Health District. Okay, so today we're announcing 30 cases up until 8 p.m. last night in the Murrumbidgee Local Health District. Of those, 19 are in the Albury LGA, 6 are in Wagga, 3 are in the Federation LGA, and 2 are in Murray River. So we have seen an increase in the numbers here in Wagga, and we're encouraging anyone who has symptoms to come out and get tested, or if they've received advice from the Public Health Unit to come forward for testing. We are pleased to see though those numbers in Albury starting to stabilise and in some cases lower on some days, so that's been very pleasing to see, and we just want to thank the Albury community for coming out and getting tested and isolating when required. It's been a really great community effort by all. We've seen a number of cases this week in Wagga affecting schools in our district, and I think that's probably been what most people are hearing about. We're working very closely with the schools, and the schools are they're currently under investigation now with the ministry, and they've sent out advice. We're working very closely with them, and I think the message to take away is, if you are part of those school environments, please remember that you need to respond to the advice that you're getting from your school. And I know we've had a couple of closures. That simply means that people have just the schools have stopped just to isolate, to look at isolations of people who need to isolate, but also some deep cleaning. So follow the advice of the school that you're getting. They will send out letters to each and every student who is currently affected. Look, not that we can see at this point in time. We know that we've got siblings and that there is some linkages within the schools, that's for sure. But at this point in time, we wouldn't want to speculate.
Are we concerned that cases may rise? Obviously, primary school students aren't able to get the vaccine yet. Do we think we may see a rise in case numbers because of that?
Certainly we know that in Albury what we saw was that 0 to 19 age group was our biggest cohort of children that were affected by, or the biggest cohort that we saw of all ages affected by COVID. So we know that by people coming forward for vaccination in the age group of 12 to 16, that then has a protective factor for those younger siblings in the household. So that's why we're very interested in getting 12 to 16-year-olds vaccinated, and we've been working very closely with schools across the district to look at ways of bringing forward if people are contemplating vaccination, and to make it easier and remove barriers for people to come forward for vaccination. So yes, whilst we don't have vaccination in that age group as yet, we know that one of the protective factors is for those older siblings to be vaccinated.
Do we know the exact days that infectious people visited the schools that had to close today for cleaning?
Look, the ones that we've just received today, no, we don't have that advice just yet. We know that one of the schools that have been identified today that have come out, we know that the ministry is working very closely with them, and that's what they do when they close that school down. They actually go in, look at all those cases, look at who was infectious when. That's the purpose of that day, is to really work out where those days are, but also then identify who's a close contact and who's a casual contact and who needs to monitor for symptoms as opposed to isolate. We know that the schools have sent out advice saying for everyone to isolate until they receive further advice from the school, and that's a message that we're sending out as well. Be guided by that. So monitor for symptoms at this point and isolate until you receive advice from your school about what to do next.
Do we have any breakdown on how many cases are at each school?
Sorry, say that again.
Do we have a breakdown on how many cases were at each school?
No, we don't. We know that we've got 2 cases in one school, and we know that we've got another at another school in that community. So at this point, they're not high numbers, but they're obviously enough for us to be, a positive is a positive. Yeah. Yep.
And do you know how many people have had to isolate after these schools have been announced?
Yes, we know in our first school that that has been this week, we had 61 close contacts, and the school has been very proactive in managing that. So it's been a very good process in working with the schools here in Wagga, similar to what we saw as well in our last positive in Wagga, which was at the Kildare that we know about. That was a very well coordinated response, and so. Our job here is to make sure that we provide the testing as well. So with that, with all those close contacts and casual contacts, comes with it a lot of testing because there's a lot of household members. So we need to really make sure we've got that testing availability for them. So we've got a lot of capacity at Murray Street Clinic, which I'd encourage all of the community to, look if they need to get testing. We've got Murray Street open until 6 p.m. We've extended those hours. We've also got Wagga Drive-through in Tarcutta Street, 8 till 5 each day. And now in response to these increasing numbers in Wagga, we are opening up the Wagga Drive-through again at the Wagga Showground. Now, we hope to have that open later today. We'll go out proactively with some media to alert you and through socials about exactly what time that will be open. But we're hoping later today that we'll see that open, but certainly tomorrow it will be open. We'll be operating the same hours, 10 till 6, that we did with our drive-through at the EQEX. So we hope with that there is going to be enough testing. We certainly haven't seen any sort of overflow in testing at this point. We've seen it's been managed quite well. So we're just always looking forward and making sure that we're providing for the community.
Is there a reason that the testing clinic is at the showground this time rather than back at EQEX?
Yeah, there is. And the reason we don't have it at EQEX now is because community sport has opened up and the EQEX model was only ever for that lockdown period and that was only available for that time. So we know now that, we knew the date that we had to work with. So the drive-through then was taken from that location for that reason.
Are the 6 new cases linked to the funeral?
No, they're not. So the funeral case, the funeral has no additional cases at this point. So we've seen no additional cases come forward from the funeral. 2 Wagga cases are close contacts of the person who attended the funeral, but they were not at the funeral. So, yep.
You mentioned schools before. Should people keep their siblings home that go to another school, a high school, for example, if it's a primary school that's closed?
Look, I think it's wait for that advice from the school. That's what we're encouraging everyone in the community who go to any of those schools or anyone school that comes forward for that has a case in the community. The advice that the schools send out is very detailed about what to do. Certainly parents will make up their own mind as well around what level of concern they've got and certainly if they need to go and get tested. We've certainly seen a lot of families come forward as as whole family groups with their siblings, and look, that's okay. We would encourage if families are worried, come forward for testing. That's our message.
Can you give us the actual figures of what's happening and how many people are vaccinated in the Edward River?
So the Edward River, we had the latest one last week, which I think Sam was around. Do we have the 60? Was it 64 point? Pardon?
I'll check that.
Yeah, Sam will check that with us. But what I don't want to focus on is that too much, because we know, and we've spoken about this, that those vaccination rates, we know there's some error in the reporting there. We're working really hard with our state colleagues, and they're also working really hard to look at how we can maybe, get these vaccination rates amended to reflect that. And we've looked at other sources of data which tell us that the rates are much higher, which is your SA3 and SA4 data. If you look at that, the rurality, which puts Edward River, or the Upper Murray, I should say, excluding Albury, above 95%. So we're looking at all of those sources now. We've got meetings, with them, and that's an active space for us. We're very committed to trying to get that rectified. We know that it's having an impact on the community out there at Edward River. They've voiced that to us, so we really want to try and, get that sorted pretty quickly.
What's SA3 and SA4 data?
So it's just a different data set. So the current data that you're seeing on the Commonwealth data sets, it comes out of postcode geocoding data. different. This is just a different way of reporting data, and it takes in a different format of how they pick up the data. So if you go onto that Commonwealth website, you'll see a couple of different data sets, and one of them is around that, SA3 and SA4, that rural location. So, yep.
In that case, you're able to give any idea about Corowa, breaking it down?
Corowa, in terms of their vaccination rate.
Yes.
Oh gosh, I don't have that on me, Simon. Sorry, you've caught me unaware on that one.
I do have a few questions about
Yep.
Corowa while we're on the topic.
Yes, please do. Yes.
So, firstly, are you concerned that a fully vaccinated staff member has tested positive and the implications of that?
Yeah, we are always concerned when we've got staff members and patients who are affected. We know that we've got one staff member and 4 patients who have tested positive for COVID in Corowa as a result of at the Corowa Hospital. I think they're all in isolation. Well, I know they're all in isolation, they're under care. I think what the message should be is that the hospital is open and people should not, not come to the Corowa Hospital for care. The ED is operating and fully functional. So that's the message there, and it remains open. So please don't avoid care at the Corowa Hospital. We have enacted out the COVID-19 safety management plan there at Corowa, and we're certainly managing that within the outbreak management procedures, so very safe to continue to go to that.
So it's just the emergency department that's still open? What are the other
Yeah,
ones that are
so when we have cases at a hospital and when we have this situation, we follow a very prescribed process in terms of making sure that we don't have any further risk come in and go out. So we have ceased some outpatient services like your non-urgent radiography, for example, and some of those outpatient clinics that we would do, just to ensure that patients, we're minimising that in and out. In saying that, it's only paused. We'll pick that up like we've seen in other places that we've managed this. And we also have, as I said, the ED fully functional. And our surgeries for this week have been paused as well. Nothing that we're concerned that will be late or anything like that. They've just been given alternative options. So that's just part of our normal process when we have COVID in a particular facility, and a situation like this, we'll always manage it like that.
So emergency surgeries obviously can still go ahead?
Yes, but just elective surgeries, yes.
Do you know how many staff in Corowa Hospital are out of action?
Yes, I do. 1. Oh, and sorry, 3 are in 6 are in isolation and 1 staff member with COVID. So 6 in isolation, and we risk mitigate that. We have a risk matrix that we follow, and if there's any risk whatsoever, as they go through that process, they go into isolation for a certain amount of days based on what risk they have. So we have 6 people currently.
How long was the staff member working while infectious? Do you know?
We're looking at a period of over 4 days at this point in time, and that we were obviously, it's early on in that process, so we're looking at a period of 4 days that we're going back. So.
Auburn office said they got a call saying that the elderly people there had been moved out. Are you able to confirm that or elaborate at all?
Yeah, no, not intentionally. No, nothing that is outside of the normal clinical pathway has happened for that reason. So any clinical reason for people being moved, that has happened within the normal confounds of how we manage our hospitals. In terms of moving people out because of a risk, no, that's not happened for COVID in terms of the residential aged care facility.
And do you have a case got in the first place? Obviously it's a staff
Yeah.
member,
Well, we don't know. We just simply don't know at this point. Our public health team are working really hard in that contact tracing space. And, as I said, the outbreak management team are working really hard to identify the source. But at this stage, it's, a work in progress. Yep.
Have there been any more cases linked to the hospital in today's numbers?
To the Corowa Hospital?
Yeah.
Yes, there has, and that's within those numbers. So the current, what we've got there is that up until 8 p.m. last night, we had a further 2. So that was within the current cases. Yep.
So how do you feel about vaccination rates?
Yeah.
And Corowa?
Yeah. Okay. So look, Edward River, as I said, we've done some really a lot of work out in the Edward, and this is what the community have been telling us as well. they've got their GPRC, so their respiratory clinic out at Edward River. We've got the hospital clinic. We've been out to Blighty, Wanganella, Carnargo, lots of places to try and see, is there anyone that we're missing out there? And certainly, the numbers tell, the pharmacy out there, they're all telling us that, there's been a lot of vaccinations. So in terms of the community's proactiveness and the partners' proactiveness, it's really good. It's really high, and we're really pleased with the community coming forward. In terms of the vaccination rates, as I said, we're working really hard to try and get to the bottom of this, to try and understand why that is such a disparity. And certainly when, we've got vaccination rates as a whole in Murrumbidgee, which is much higher, and currently our rate as of today, we've got 95%, more than 95% of people aged over 16 with first doses, and then we have 90.5% with second doses. So, we would hope that we'll get to get to the bottom of what's going on for Edward River. Yep.
Have we seen any instances with the rapid antigen testing that sort of caught cases and stopped an outbreak potentially happening?
Look, not that I'm aware of. We're certainly using it, as you know, and the Department of Education are using it in Albury within their that current outbreak. And certainly from our perspective, it's a very good tool to use in combination with what's happening. We're also using some of that, but I can't think of a particular case where that's at this stage where we've seen that. But it's a valuable tool when it's in combination with many others. Yep.
So the positive results that you report on a day-to-day basis, are they just from the PCR test?
Correct. Yes, we would never report on RAT testing or rapid antigen testing in our figures. It's only PCR testing. Yep.
Those rapid tests are now available at the supermarket this morning. How do you feel about that? Is it good, bad?
Well, I think anything that's encouraging people to get tested and be proactive is a good thing, and to get people thinking. And we all know that if you are getting, I suppose the big message is for people who are thinking they're going to go out and purchase a rapid antigen test from a supermarket today, my message to you will be is please ensure you don't rely on that solely. If you've got symptoms, come forward for a PCR test. Come forward to a clinic and have a PCR. That is the only way you will know with the accuracy that you do not have COVID.
Because they're not as accurate as
they are not. No, they're not. So rapid antigen testing is not as accurate, and it depends on what brand. But we know, they sit anywhere from 50 to 70%, where our PCR testing is, upwards of 98%. So it's very different test completely. So the message is, if you have symptoms or if you've been in an area of concern, or any other reason that you think you may be exposed to COVID, come forward for a PCR test. Come forward to a clinic and get tested. Our turnaround times are around 24 to 48 hours, so they're good, and so you'll get that test back pretty quickly.
Do we have any updates on the Mercy Place outbreak?
Yeah, so look, that we do, and the Mercy Place, they will, from what we've seen, is that there've been no new infections. So we're very pleased with that in Albury. Both of those aged care facilities are managing COVID that specific space very well, and we should see by Monday that the 14 days has surpassed with no further infections in that period, and that's a good outcome for that.
Would you sort of spread that positivity then to the rest of Albury? Do you think the outbreak there is kind of settling a little bit?
Well, look, we've seen the numbers, as I said, they're starting to, obviously they're smaller than what they were this time last week, so that's a good thing, but vigilance is the key. It doesn't take much for it to, start again, so, the message is really important here. Please don't underestimate the 4 key things. Vaccination, QR coding in, so we know, we can get in contact with you. We've seen that that's working brilliantly with the Service New South Wales app, quickly sending out those notifications. Testing if you've got symptoms or you've been anywhere. Don't underestimate your symptoms, come forward. We've seen in cases where people say they're asymptomatic and they're testing positive. So it's a really important message, to come forward. And, that mask and that hand hygiene and that social distancing, just not to underestimate those basic things. And I know I say them each week, But really, that is the key to, ensuring that we manage this. But really appealing to that 12 to 16-year-old age group. Parents out there of that cohort, please come forward and get vaccinated. We've got a lot of vaccination in the community right now. It's really important. And those vaccination rates are a bit lower in that 12 to 16-year-old age group. And the reason for that, we know, is some of it is around the cohort not becoming eligible until much later. So if we can really focus, if anyone, the message is today, it's focus on that 12 to 15-year-old age group.
At Corowa Hospital, you mentioned that it's still being investigated how the case emerged there, or the outbreak started. Could it potentially be linked to the cases in Rutherglen?
It could be. It could be. I mean, it's certainly a very close area. We know that anywhere, and so it's very close to Albury as well. So, it's really hard at this stage, to pinpoint exactly. And I think the important message is, for us, it's about that really good, as we've just spoken about, those 4 points, but for us in our hospitals also too, to make sure we're screening. So when people are coming into hospitals, they're answering and screening appropriately and making sure they're not coming in with unwell symptoms, and that that PPE is being worn in a very, regimented way, and making sure that people are using that. So regardless of the source, it's just really important that we continue to do those things to minimise any sort of high risk venue like a hospital. We have to be extra vigilant, or an aged care facility. They're our high risk venues, so people need to be extremely careful in making sure that when they are going into there, that they are abiding by all those screening requirements and PPE requirements.
Do you know how long the patients were infectious before they tested positive at the hospital?
We know that there's that 4-day window. That's what we're looking at. So we're looking at that 4-day window back then, and so that's where we go from. So in a high risk venue, we actually look at 72 hours prior to the onset of when that case either had symptoms and tested positive. So it's a 72-hour prior to that. So we actually go back quite a bit. And it's normally 48 hours in the community. So just to be extra cautious, we go back another day. Yep.
And is the MLHD satisfied there's enough testing in Albury to say that the current outbreak is under control?
The testing, what I get the numbers, and I would say that the testing is telling us that there's certainly enough testing in terms of what's available to the Albury community. We are seeing declining numbers, and so that would be indicative of the current outbreak. And there's only so many tests you can have. So we have seen we saw an enormous uptake of testing from the Albury community, so that's been amazing. But in terms of the current availability of testing, we're also very pleased with that as well. We've got a number of drive-throughs, we've got a number of walk-in clinics, but also in saying that, we've got a number of vaccination options for people down there too. So we're really trying to make sure across the board, in partnership with our private pathology providers, Albury Wodonga Health, and our PHN, Murray PHN, all of us are working towards providing that for the community at a number of different outlets. That's the most important thing, is trying to remove the barriers and making it easy for people to come forward to get tested and vaccinated.
Has there been any surge in testing demand in Corowa, and has there been any extra testing resources established there?
Yes, there has. So we have seen a surge in testing. I can tell you that normally the testing is not that high. We're seeing 20 to 30. It's gone up to over 70 yesterday. But we also opened up our testing facility between 10 a.m. and 3 p.m. at the Corowa Hospital, and we'll continue with that daily schedule, 10 a.m. to 3 p.m. This week, and we'll monitor that every day to see the need going forward. So if anyone in the Corowa community needs to come forward for testing, we would encourage you to do that between 10 a.m. and 3 p.m. at the Corowa Hospital.
Yep. Well. In Albury, it sort of said before that around 2/3 or a large majority of cases were children, or that
yes.
under 19 age. Is that what we're seeing in Wagga with the cases coming up? Are they, what are the ages of these new cases?
Yeah, look, we're certainly seeing I would say a more varied spread across Wagga at this point, but remember, the numbers in Wagga are much lower at this point in time. But it's varied. I would say it's school children to adults, so we're not seeing a clustering that we can't set with the small numbers that we've got at this stage. But yeah, quite varied across the age groups at this point in time.
And because we're moving towards a situation where we're living with COVID and we have a vaccinated population. If we were seeing the number of cases we're seeing now 12 months ago and the number of exposure sites, do you think we'd be in a much worse situation?
Absolutely,
than we are now?
absolutely. Vaccination is the key. So we know, and this is what we report each day on hospitalisations as well, our very small amount of hospitalisations. This time last year, if we had the current outbreak, our hospitalisations would be much bigger. And that's the concerning part for us, is that we want to make sure that, the community, that's why the vaccination is so important, is that they're not coming into hospitals, because coming into hospitals means, they're needing that level of care. So the vast majority of people who are, in the community with COVID, they actually, are on our care in the community KIF model. So that's really promising, and that for me is probably one of the most important messages. So yes, 12 months ago we would have seen a very different outcome.
And just last one from me, as a community, should we be doing anything differently with these exposure sites popping up, or is the message just really just to go and get vaccinated?
Same message, and as I said before, don't underestimate the importance of that. We're seeing first timers come for vaccination in the last week and 2 weeks, and that's really promising. These are people who may have thought, I don't know whether I need to do that, or we're seeing them come forward, and that's, for us, we want to see as many people as we can. We see that obviously our rates are over 95% for first dose, and that's as a whole. But we certainly know that there's still others out there that and particularly in that 12 to 16 age group, that's who we want to see. So lots of parents out there, I'm sure today, with these schools involved, maybe thinking about, should I bring my kids in? We're here, walk in, no appointments necessary, just walk into a clinic.
Do you have any figures, Emma, on how many people you vaccinated in the Edward River last week?
Oh, in the Edward River last week? I don't think we do we? We don't have those in, we don't have those in, but what I can tell you is we're upwards in the Murrumbidgee. I just had a look, Simon, at the figures for us. We've hit over 59,000 vaccinations this week. So that's an incredible amount of vaccinations. I think we were here not long ago just looking at our 50,000th number. So it doesn't take long to work out, there's 9,000 in that short amount of time. So people are coming forward. Look, and in saying that, we have had our booster vaccinations also come on board. And so we are seeing, particularly those people that had it in March, and that's March, April, coming forward for boosters, which is really good to see. So we're also encouraging the community, if you are eligible, you have reached your 6 months for a booster, come forward, come and get a booster. You'll be offered a Pfizer vaccine. That's what we've got, and that's what is recommended. So anyone that, particularly in those high risk settings, which we know in March and April were our health facilities and our aged care facilities and our emergency services, they were our first cohort, 1As and 1Bs. So come forward for a booster.
Thanks, Emma.
Righto.
Thank you so much.